Welcome back to the show. If you've ever wondered if your prescription is covered, well, wonder no more, because there's a wonderful tool out there. And to tell us more about it, I am joined by the Executive Director of the Canadian Skin Patient Alliance, Rachael Manion. Rachael, welcome to the show. Wonderful to have you. Rachael, let's talk about your particular organization. For those that aren't familiar with the Canadian Skin Patient Alliance, who are you and who makes up the alliance?
We are Canada's go-to organization for people who are impacted by skin, hair, and nail conditions across the country. So there are actually more than 3,000 different skin, hair, and nail conditions, 1,000 of which are rare. And so there's actually a lot of diversity in our community, as well as when it comes to their needs in accessing medications.
Yeah, I was going to ask you, so how do you then help support patients across the country?
So we produce a lot of educational resources. We do a lot of advocacy on their behalf. And we also are involved with a network of other organizations here in Canada that also help specific skin patient communities. And together we work really hard to make sure that patients today can access what they need, and that patients tomorrow have a better experience in the healthcare system and with all of the things that they need to access in order to support their health.
I teased it off the top there. You have launched this new tool, which I think is just incredible. Tell us about this tool and how it works.
Absolutely. So what we did is we built a click-through module on our website, which you can find at canadianskin.ca. It's called Is My Prescription Covered? Because we know over the 15 years that we've been around, we've had a lot of questions from patients and caregivers about what to do when they're actually holding a prescription in their hand. So they've been, in and out of doctors' offices, they've got a diagnosis, and they're ready with their treatment plan, trying to access something. And what we do is we'll ask them a bunch of different questions about who they are and what it is that they need to access. And then we put all this information together in our heads, and in order to help them answer the question, how do I get access to this now that I've got the prescription?
Right.
And so what you're seeing on the screen is actually a little bit of a show of or a demo, I should say, of how we put it together on our website. So if you come to our website with this question, is my prescription covered? You'll only be asked yes or no questions.
Okay.
And this will help you figure out if your prescription is covered for you, or if you actually are eligible for public drug plan coverage that you didn't necessarily realize you were eligible for. And it will also give you a better sense of kind of what's out there for you. We do also have some prompting questions. If you don't actually, if you're not able to access your prescription through a federal, provincial, or territorial drug plan, we'll give you some prompting questions to help you figure out if maybe there's actually a private plan out there that you're able to access. And this is all with a view, Derek, to helping people access the prescriptions that they need in order to live a healthier life.
Yeah, and this isn't just, Rachael, for patients that you work with, right, with skin, hair, or nail condition. This is open to everybody, and there's a great need for something like this. I'm almost surprised that it hasn't happened sooner. So, hats off to you and your team for creating something like this. But yeah, maybe just expand on the need that's out there and how difficult it can be for people to just go through that process of, if their prescription is covered or not.
Yeah, absolutely. We know because this tool actually focuses on public drug plans. So those are drug plans provided by governments in Canada.
Right.
And usually they're provided to folks who are seniors or who, access some kind of a social program through the government. And in some provinces across the country, they actually have a plan that's open to anybody who lives in that province. You do have to sort of buy into it, but they do have a program that's available. So we know when we've looked at all of these plans, Derek, that there are so many, there are dozens of them. And sometimes it depends on sort of your own personal characteristics, which sort of demographic you might belong to.
Right.
Sometimes it depends on which condition you might live with. And we can really kind of, we think this is also a really great time to be launching this, because we're having all these conversations as a country about national pharmacare and access to rare disease drugs. And, it's really important that we understand, I think, what's actually out there for us.
Agreed.
Before we start thinking about and discussing together what we actually need to change. What are the gaps that we need to fill?
Appreciate your time. Sorry, we've run out of time, but thanks so much for joining us.